Hey, it's Bradley J. And today, I, like you watching right now, are going to hear a big announcement from Vallejo Behavioral Healthcare and Family Service and Guidance Center. And I want to bring on Kathy Mosier. How are you?
I'm great, thank you.
You bet. So I hear that you have, well, I guess let's just say it's a big announcement and it has to deal with mental health. So let's get right to it. What is the big announcement that you and we're going to bring on Bill Persinger a little bit later on that you guys are collaborating with?
Yes, we are. We are excited to announce that we have reached and achieved certification as a CCBHC, which is a lot of letters that really say a community behavioral health clinic. Now, more it says clinic, but it's much more of a model that overlays our licensed community mental health centers, both of us. And what it's going to do is it's going to enhance services for our community. It's going to increase access and availability of services and reach more people in our community.
That is fantastic, especially the reach, because I think there are a lot of people out there that they feel like, maybe this is something I can't do, or I'm too far away, or I just don't have time. And it kind of sounds like this collaboration is going to help someone who's thinking that way. Is that right?
That's absolutely right. We want there to be no wrong door to enter, and that's why Vallejo and Family Service are collaborating even to a higher level than we have in the past. But we're also taking our services outside our four walls to people who, for whatever reason, can't seem to get to us. For instance, at Family Service, we are embedding our services into the schools so that we are where the kids are and can help find those kids that are maybe falling through the cracks.
And that helps out for parents who, because parents are busy, like they have kids, but they also have to provide for their family. So they're out and about and they're working. And with you guys being in the schools, you're right there, like you said, for the kids. And do you hear a lot of response from like parents I mean, like in this collaboration, do you expect to hear a lot from parents going like, thank you so much. This is going to help our life and our children so much.
Absolutely. We're hearing things like my job's not in jeopardy anymore, or it's taken the stress off, be getting dinner ready for the family to bring them in after school. Just a lot of positive, and transportation's an issue all over town. And so it reduces the transportation need.
Well, I want to bring Bill Persinger in here as well. Bill, how are you? Welcome to the
Wonderful, wonderful.
conversation.
Thank you.
We had you. How did you like our? Yeah, how did you like our green room? First of all,
Yeah, I loved it. It was blue on my end, but I loved it.
I want to get to because with this collaboration of Vallejo and Family Service Guidance Center, you're going to be out in the community. You're going to be where you can be. But also, does this mean that is there a possibility that you're going to add to staff as well to as you collaborate and bring together? You're going to need more people to do that reach program.
That's a great place to start. Both Vallejo and Family Service have been pretty well staffed over the years. Been pretty tough last couple of years to find staff. Our licensed therapists and case managers and our prescribers, whom we value so much, our peer support workers. But we are starting to fill some of those vacant positions. And then, under a CCBHC, Certified Community Behavioral Health Clinic model, of course, we're both going to continue to be licensed community mental health centers, offering services to anybody who needs it, regardless of their ability to pay. Many of our programs, both agencies, 24 hours a day, but we will be able to add staff, particularly peer support workers on the adult side, crisis people who work along our crisis continuum of care to try to, help folks stay at home and stay at work and stay with their families and stay in school and stay in the community, stay with their social network. So we will be adding staff, therapists at the front door, so to speak. So access will be improved. So if you just think of this thing figuratively speaking, a bigger front door, bigger rooms, longer hallway, wider hallway, so to speak.
We're talking with Bill
Not be a
Persinger. Oh,
go ahead,
go
please.
ahead.
I'm just gonna say it's not going to be a perfect system, but I think people will see, great improvements over time. The whole thing starts July 1. So I often tell people it's community mental health on steroids, if you will. Stronger, more powerful, more durable. But the main thing is the whole person, trying to find a way to help the whole person, body and mind, and help people find, primary care doctors, help people with a health action plan, something they do to improve their physical health along with their mental health, and trying to engage people, stay in closer contact with our clients to make sure that they come back to their appointments, make sure that their services are progressing along their individualized treatment plan. So staying in touch from the get-go is going to be not a new emphasis, but a stronger emphasis in what we do. We are trying to engage with our clients now, but we'll have more capacity to do that going forward.
That's awesome. We're talking with Bill Persinger, CEO of Valea Behavioral Healthcare, and Kathy Mosier, CEO of Family Service and Guidance Center. One of the things that I know when I hear about a collaboration, I'm always like, man, this is going to be better for me. Is this going to help people like see you two quicker? Is this going to get people in quicker? And also,
It will.
The big thing for all of us is always money. And you guys do a really great job of, regardless of their ability to pay, and they're going to get help.
Yeah, I might address that, and I'll sure defer to Kathy. Right now people can walk in to Vallejo, and I know it's just the same down the street, our partner agency, our sister agency, Family Service, and get an appointment. In fact, licensed therapists are on call 24 hours a day in a case of a crisis. But so what it will mean would be, for example, our intake department. You first come in, you sit down with a licensed therapist. We'll have more of those folks, more licensed therapists at the front gate, so to speak, to visit. It means you get in sooner. You could get your counseling appointments started more quickly. You can get your medication appointments started more quickly. You'll get your case management, your peer support, your crisis support started more quickly. The CCBHC is a movement that started nationally back in 2014 with the passage of the Mental Health Excellence in Mental Health Act. What that does is it allows Medicaid, our main payer at both agencies. And if I could pause for a second, Medicaid, Title 19, is to a community mental health center what Medicare, Title 18, is to a hospital or a nursing facility, for example. So it's our main third-party payer, and it's a huge chunk of our revenue budgets. So under the CCBHC model, as we both meet the higher standard, engagement, follow-up, crisis care, easier access, integrated care, that is whole person care. Since we have been provisionally certified to meet those standards, Medicaid will pay us at cost. That will be a new thing. It's a great innovation. We each have a cost of operation per day, and Medicaid will pay that cost. So that'll be a revenue enhancer for us. And then the other grants that we have, as those remain in place and even grow, then we should both have additional resources, which is another word for funding, to carry out these and meet these higher standards that will be expected of us. So Kathy, I sure add your perspective. And
what that means for our community, I'll just add to what Bill's saying about the funding, is it's going to allow us to build capacity to meet the need, because the need's been growing, both with kids and adults. And, we went through a rough time with COVID, and no matter how you feel about how things were handled, it was just stressful time. You lost your social network.
Very.
You had a lot of extra worries. And so over that time, we've just found that the mental health issues have continued to rise. And then now we have even youth suicide and addiction issues rising. So we want to catch them as early as possible. And then we want to kind of make the linchpin of this new model, which is so exciting, is really about whole person care, whatever their needs are, and finding ways to address that. So that might not be everything that we do, but the rest of our great community partners in Shawnee County can help with as well. And we strengthen those relationships, and we all come together sending the same message to the client, dealing with all their issues, whether it's physical health or behavioral health. And that means things like not just a referral to their doctor, but a warmer handoff to help them make the appointment, ask them if they have transportation, following up afterwards to say, how did it go? Did you get what you needed? What do you need help with any next steps? So we're excited about making that
Well
seamless.
said. You know, and we're not just going to launch this thing as, you know, out of context or just, you know, plop it out there in the water or out into space. The CCBHC certification that we've both attained, along with the other mental health centers in the state of Kansas, exists in a context of city, county, state, and federal government support, all of which have stepped up in the last couple of years. I mean, it's a great thing to see every level of government step up together, you know, arm in arm, if you will, to support public mental health, like Family Service and Vallejo and Breakthrough House and other providers around the state who serve anybody, you know, regardless of their ability to pay. So, you know, our government partners, you know, and our commercial payers are all in there with us. So it's not just a thing that we're doing. It exists in the context of that increased support from government that we've seen for public mental health, particularly the last 2 or 3 years. Everybody's really stepped up, and it means so much to, I know, to Kathy and I and our boards and our staff and the people we serve to see everybody get together and say, you know, mental health and addiction services, because when we talk about mental health, we talk about behavioral health. It also includes, you know, treatment for addiction services, which both agencies have. And you know, to see government get behind that solidly, even more than they have the last couple, 3 years, just heartwarming for me and very encouraging. So
I was gonna say, you guys have touched on it, but one of the things you see, like the collaboration comes together, and it's always bigger, better, which is great for the community and great for Topeka and Northeast Kansas. But sometimes there are people out there and they're like, you know, like I have this niche problem, and they worry about that service going away because people do get bigger and better, and they're like, we want to provide more, but it doesn't sound like that's going to happen. It sounds like you guys have all the bases covered from like, you know, from what number one to whatever goes down there. So no services are going to be left out for Topeka and the surrounding area. Kathy, I'll let you touch on that a second.
That's right. This is just going to grow our programs and enhance the quality of those services, and then add things like care coordination and whole person care to the mix. You bet.
This is awesome, man. Thank you guys for taking the time out of your day for this huge announcement, a collaboration that is, mental health and behavioral health. It's just going to make it better and easier for people to get to, and families are not going to have the burden. They don't have to worry about it. I mean, we're lucky to have Vallejo and the Guidance Center here in Topeka. And thank you again for taking the time out to letting us know about this and giving information. And we will be sure to get the information out to the people so that they know what's going on. Again, Bill Persinger, CEO of Vallejo Behavioral Health, and Kathy Mosier, CEO of Family Service and Guidance Center. Thank you so much for your time.
Thank you for having us.